podcast. I am your host, Tamika, Executive Director of the dfree Global Foundation. I'm excited to have my co-host here virtually with me, Dr. Soaries. How are you?
All right, all right. How you doing today, Tamika?
I'm here. Just so our listeners know, we are recording live in separate places. We are socially distancing, given the COVID-19 quarantine slash social distance slash stay away and stay healthy experience that we're all going through. So thank you so much for listening to dfree in the Black. We are excited to not only bring you general financial information to keep you in the black, but also relevant and timely information to keep you in the black as the world changes. That almost sounds like a soap opera. But we're here and we're excited to be with you. We have an amazing guest on the line who is a boss of all bosses with a heart of gold. We have Miss Michellene Davis Esquire. She is the Executive Vice President and Chief Corporate Affairs Officer of RWJBH Health, the largest private employer in the state of New Jersey, an amazing healthcare system that is helping to keep New Jersey afloat as we experience COVID-19. How are you, Michellene?
Hello, Tamika. How are you? I, too, am here, this side of the ground, and so all is well.
All is well.
Excellent.
Tamika,
Excellent.
Micheline Davis is one of the most outstanding women I've ever met in my life. She is one of the most significant, influential African Americans in New Jersey, and she is a national healthcare voice and advocate not only for the health of people outside of her system, but also the physical, emotional, and financial health of the people who work there. So, welcome, Micheline.
Thank you so much, Soaries. Thank you.
What's so astounding to me,
Okay.
Micheline, is how you balance your various positions, your expertise, and your focus. On the one hand, you are concerned about healthcare policy, and you've been an advocate for closing disparities that exist among African Americans and the general population. You've been a healthcare professional supervising the administration of health services. You've been a community advocate, expanding the scope of the system into social impact type activities. But you've also had a laser like focus on the welfare of the 33,000 employees that work for the system. And so you and Tamika have been working together to bring some financial education and financial information to the employees. Talk about that.
Oh my goodness. First of all, thank you so much for your kind commentary, Rev. You know, it doesn't feel like that when your head is down and you're just doing the work. So I deeply appreciate that, and I'm going to make certain my parents hear that part. But I will tell you that it has been a sheer delight to have the opportunity to work with Tamika, who is like capital B brilliant, not just in this space, but in so many, as we endeavor to do exactly what you described. And for me, the real reason is because all of those seemingly different things are actually all intricately intertwined. Quite frankly, you cannot be concerned about the community if, in fact, you do not have an understanding that your employee base is your first community, right? And to that end, for me, as we endeavor to ensure that not just that we are in the business of the delivery of health care, but quite frankly, ensuring that those communities are healthy and well long after they leave our doors, and quite frankly, long before they ever get to our doors. It's really intrinsically important that they are financially well. And if you carry over what I just said in reference to our employees being that first community, think about that, right? So many of your employee population lives in the communities in which our facilities are situated. We have such a large and expansive organization where we treat 2/3 of the New Jersey population. We are in suburban and the urban areas that range from the Bayonne Peninsula in the state of New Jersey, up in Hudson County, down through Essex, and then the center of the state. With facilities in Middlesex and Mercer, and then over down the shoreline, right, in Ocean and Monmouth. And so we are this vast entity where that's just where our acute care facilities and our behavioral health hospitals happen to be. But then we have some 9,000 doctors, and so we have these two very large-scale physician practices. One is Barnabas Health Medical Group, and the other is the RWJ Physicians Enterprise. So they all have offices as well. And if you look at that, our joint ventures and everything else, you're really talking about a very expansive footprint. So our employees live in these communities, and it was incredibly important to have the fortunate opportunity to work with the brilliance of Tamika. And how do we make certain that we are shoring up this first community internally so that their external well-being is such that their internal sustainability is a natural part of our infrastructure. And she has really helped us to do that in a very definite way that reaches our employees through the dfree program.
Great.
Excellent. It's been really exciting. RWJ has actually been the first partner that we've had to do dfree in this way. I know we've done some corporate outreach in the past, but you guys are actually the first partner to adopt the full dfree curriculum in a digital capacity for your employees, to one, make it more accessible to everyone, to keep it confidential, and to really give employees a resource that they can own and use themselves to, take them through our curriculum and our experience. And based on the feedback that we've gotten, people are really benefiting from it. And it's important, and it's a great example of how an organization that's really invested in its people care holistically about what they're doing. And so I really, shine a light on the work that you all are doing to encourage your employees, not just during these emergent times, but to have been, have that as a forethought even before we got into the COVID-19 experience. Can you talk to us a little bit about some of the things that the hospital, the system is doing in general to help employees during this time? It's really, I can imagine the numbers are up in terms of the patients that you're seeing, the anxiety is up, even the types of, medical experiences people are having. What are some of the other things that you all are doing beyond the dfree piece that people may not get a chance to see as we're living through these COVID-19 times?
Well, I appreciate that, and we'll definitely want to come back to your comments, because the truth be told, while we may be the first, I will tell you that we will not be the last, and I think that is the spotlight that COVID-19 and this experience of the coronavirus is really placing on businesses and on corporate entities in the way in which we care for our people. So thank you for saying that. But I will tell you, so what are we doing for our employees generally? Oh my goodness, it has ranged from everything from literally converting segments of our cafeterias to miniature grocery stores, so that our employees who are on the front lines and doing exactly what it is that this country needs for them to be doing right now do not have to forgo the well-being of their families. And so we literally converted segments of our cafeterias so that they can get milk and bread and cheese and eggs, because they are still, right, in addition to being clinicians and nurses and cleaning people and superheroes that they are also mothers and fathers and sisters and brothers and caretakers. And so we wanted to make certain that they had access to that, and that they had it right here, to literally increasing something that we call flex wage, which literally we almost, it's such a perfect couple to dfree. Flex wage permits our employees to essentially attach to their own future earnings so that they can eliminate predatory payday loans and there's incredibly high interest rates that gives them an opportunity to immediately be able to literally pull down some of their own dollars right now. So we've had some everything from increasing our traditional benefits to wellness programs to free tax preparation to flex wage, but also we're really focused on their overall and all comprehensive experience right now. And so also making certain that we are attaching to their ability to receive the assistance that they need in reference to the trauma that they're experiencing. So ensuring that we are talking about mental health and behavioral health and their well-being the same way that we are talking about financial literacy and financial well-being, and trying to make certain that there is no opportunity for anything that would prevent them from being able to attach to that more readily. And so we've been able to really make certain that all of these things are available to them. But Tamika, if I may, I'd love to get back to just a moment of what you said about the way in which you wanted to adopt the full curriculum. And talk a little bit about, if it's okay, about the way in which we rolled this out, and the fact that, we started with a soft launch that resulted actually in 62 employees beginning to engage, which was double what we anticipated per facility, right? And so as we factor in our business units, so these are just not our hospitals. This includes our specialty care facilities, our Cancer Institute of New Jersey, our behavioral health network, our system business office, right? What we wanted to make certain was that we provided an opportunity for everyone at every level to see this as viable resource for them. And so what we saw, and what I think that's going to be really important for our corporate folks to hear, is the fact that employees that enrolled were incredibly diverse, that they were representing all titles, all positions, and all salary levels, right? That this wasn't something that we rolled out for, hey, you over there who may not be at the higher end of the payroll scale, but quite frankly, we rolled it out as a overarching aspect of these are our offerings to you, and so our clinicians and those who have been here for 20 years and those who have been here for 2 months take advantage. Yep. And I think it's really important that folks understand that when we attempt to introduce something like this, that equity is a part of it, and equity requires dignity. And so making certain that it's not described as only being for certain folks, right? For those folks who are not financial literate, because what we realize so much is that, oftentimes the physician that pulls up in the Lamborghini, isn't particularly financially literate. And so, they may be driving that in the day, but they are renting at night. And so, what do we do in order to make certain that it's available to everyone? And that's really what I think is unique about the dfree program, that everybody wants to get out of debt. And so even your packaging, and the reason why we wanted the full curriculum is to make certain that those individuals who come to us, present to us at a variety of different educational and financial literacy levels are all given an opportunity to go deeper.
So, Mitch, if I'm an employee of RWJ Barnabas and I've heard about the resource called dfree, exactly how do I access it, and then what is the it that I'm accessing on a very basic level?
So, great. So you will go to our intranet. We happen to call it the bridge, right? Because it is that which connects us. And so you would go onto the bridge. You would find the opportunity to enroll. You would very easily navigate through that. It's extremely user-friendly. It provides you with materials and takes you through an online platform. So what's perfect is that for those who have the privilege and the opportunity to work remotely, right, this is a prime time for them to do it, right? I think that in this aspect of shutdown, of coronavirus planning, and quite frankly experiencing, lots of folks have spent some time with their money, right? A lot of folks who oftentimes perhaps are not best about that and who don't love doing that have had to do it now. So what's really awesome about the dfree program is the fact that it is literally made for this long before we were here. So they can attach to all of those resources from wherever they are. What is great about being able to operate on your intranet is that, yes, we can do it for those people who are able to work from home, but they can also access it if, in fact, they are frontline employees and they're on break, right? So having the opportunity to be at this big stoic organization, to be nimble for our employees is key, and that's how they be able to attach to it.
Great.
Absolutely. And it's really simple on the back end. What we tried to do was we created a dedicated platform for the RWJBH employees to go into, so it's purely their ecosystem. We've included company-related branding. They do get access to a free dfree workbook that they can use alongside the video materials. And so everything is really self-contained. It's confidential. And once a user registers and signs up, the only thing we really verify is that they're an actual employee of RWJBH. And so once that's done, they're in and they can really take themselves on a paced journey through the dfree curriculum. And I'll tell you, we've had a few additional signups since COVID-19 started. So just to echo your point, Michellene, as people are home and they have time to kind of find time, and then the added pressure of really needing to pay attention to their finances, we're excited that they're actually taking action to do something about it.
Yeah.
And so it's really encouraging.
Absolutely. Absolutely. And honestly, I think that you're only going to see those numbers go up. So, listen, happy to have entered this relationship with you. I hope that you're in for the long haul, because I know that we are. I think that you are going to begin to see individuals who, as we both peak and then begin to see some flattening of the curve, and then, if in fact we get back to, I don't want to say go back to normal, because I'm not actually certain what that's going to look like, but as we begin to normalize our new, I think that you will see that more and more, right? Because right now, folks are so many individuals are really just focused on the crisis. As they are able to pull back from that, and as we get new employees in from across the nation, a lot of nurses and clinicians and respiratory therapists are volunteering. And I saw an announcement just, I think it was earlier today, or perhaps it was yesterday, from the governor about a new initiative. He's partnered with United Airlines and another in order to fly in clinicians to volunteer at our hospitals, so that we can give our frontline workers, just some amount of a break. That the more that occurs, we're going to be able to see a lot of online activity. I know that it's going to be something that is a first thought. And then, quite frankly, one of the things that in talking with my partner, who is over human resources, Marty Everhart, which is actually, we placed and situated dfree in HR, and Marty's just been a really great partner, just phenomenal in this space. And one of the things that he and I talked about recently was the fact that, what history tells us is that after going through something, like this, although we've never had anything quite like the coronavirus and its impact, but after we can expect something like this, history tells us that we tend to see large-scale retirement of individuals 60 and over, right? Mm-hmm. And so as a result, that's exactly what I'm talking about. Why I know that individuals are going to begin to really take a closer look at, so what does this look like for me? What do I need to do in order to, assess the way in which I want to live my next 60 years, my next 50 years, and how can I do this in a way that sets both me and my family up for sustainability? Having this resource already embedded in our system, I feel like has been the best thing that we could have ever have done. And it is because of the fact that we can spend this time not having to rush to introduce something, which quite frankly, we would probably never even get it in front of anyone, because again, everyone is so focused on the pandemic. As they should be, right? As they should be. But the fact that we spent months in advance saying, this is available to you, this is our social impact community investment, mission-driven, dedicated focus for you, this is how we are making certain that you are treated well as a community in advance. This is already in the back of their mind now. Right? So they don't have to fight through the white noise of the constant news cycle, or quite frankly, the trauma of dealing with this every day. They know that it's there. It's a good level of insurance. It's something that they can come to, and so we expect those numbers to go up.
Well, listen, this is marvelous. This is marvelous. In case you don't know, this is In the Black, the dfree podcast. It has featured today Michellene Davis, Esquire, and Tamika Stembridge, Esquire, which is why you haven't heard my voice much, because the Esquires have been esquiring together without much opportunity to break in. So I've just been operating the sound and holding the microphone for the Esquires. But I couldn't be prouder of you ladies for your combined genius, for your passion to help other people, and both of you are lawyers who could have simply used your credentials to go into the private sector and just become rich, successful Wall Street lawyers. But you are working in spaces that will impact not only communities but future generations. And I just have great respect for both of you and thank both of you for what you're doing for those employees in the RWJ Barnabas system.
Thank you again so much for joining us, Michellene, and we look forward to expanding the partnership. Whatever we can do to support, we're here. Stay safe, stay well, and stay encouraged, because we need you on the front lines as you are to really help drive things forward.
Right,
Well,
we
thank
need
you.
you.
Thank you to you both. Thank you for the vision and the opportunity.
Thank you.
Excellent.
All right, take
Has
care.
been In the Black, and we'll talk to you soon.
Thank you for listening to the dfree In the Black podcast. Our goal is that you stay in the black, which means that you should subscribe to the podcast, go to the website, join the $1 Billion Challenge, become a part of the dfree financial freedom movement.